This is Kylie. She was a former 24-weeker. She was born here at Geisinger. She ended up in the NICU because she was so early. She was 1 pound 3 ounces when she was born. The NICU experience was very different than we thought it would be. I personally had some concerns that there wouldn't be a lot of interaction with our daughter, and a lot of the staff would be, how we would interact with the staff. So it actually ended up being a really wonderful experience with the staff. They were very caring, very compassionate. They really gave her incredible care and gave us the incredible support.
Welcome. I'm Maureen Lloyd, the Operations Manager of the Neonatal Intensive Care Unit. The purpose of this video is to introduce you to the care that will be given to your baby. Our mission is to provide the best care possible for you, for your baby, and for your family.
Hi, I'm Mindy. For those patients admitted in our labor and delivery and at risk for delivery prior to 30 weeks gestation, you will deliver in the C-section rooms that are behind me here. Your baby will actually be handed from a nurse in your C-section room to a team of NICU staff persons right through this window, and then admitted to a warmer where they will be stabilized and treated accordingly. After your baby is admitted to our neonatal intensive care unit, it will take about 1 to 2 hours for our staff to stabilize your baby before we'll permit visitation. We'll keep in touch with you via your nurse in labor and delivery, and also through the hospital staff if your baby has been transferred from an outlying facility. We'll also do all the vital statistics for your baby right here in our unit, such as weighing them and measuring their length will all be done here, and we'll get that information back to your labor and delivery nurse as soon as we're able to. So these are some patches that will be attached to your baby's chest and will be connected to our monitor and will give us various readings that we need to know in order to make sure your baby is healthy. This is some saran wrap. If your baby is born extremely premature in our NICU, such as around 24 weeks or so, their skin is very thin. They can lose moisture and heat very quickly, and that saran wrap is used to help keep them warm and keep that moisture inside. This is their pulse socks, which will be like the red glowing clip that an adult would wear on their finger. We place that around the infant's hand or around their foot. These are some IV pumps. So if your baby needs an IV for nutrition or for medication, it will be connected to these pumps here, and the pumps will be regulated and controlled by the nursing staff.
Hi, my name's Angela. I'm a nurse here in the NICU at Janet Weiss Children's Hospital here at Geisinger Medical Center. Upon admission, most babies are admitted into an overhead warmer such as this one. The overhead warmer works with the probe that is placed on the baby's abdomen, which reads his temperature, and this overhead bar then will kick out more heat or take less heat away just to keep your baby warm. Your baby will not be dressed when he's under the warmer, but he will have a diaper on. On his chest, we place 3 sticky tabs that monitor his respirations as well as his heart rate, which are then connected to this monitor: heart rate, pulse ox, which I will talk about, and respirations, which are set to alarm limits and will alarm if he goes outside of those limits. This glowing red probe sensor on his foot or his hands monitors the oxygen saturation in his blood. CPAP, which baby is breathing on his own, but it provides respiratory support and means that it's a continuous positive airway pressure that holds the lungs open with or without oxygen, so he is breathing on his own. This nose piece, which can be a mask or prongs, fits snugly on his nose, and it's held in place by this white cap. He will then also have a NG tube or an OG tube, which is inserted into the mouth or the nose, which provides a way for us to feed him as well as release excess gas that may build up in his stomach from the CPAP. We have here a former 24-weeker who now weighs 2 pounds and 5 ounces. Sometimes when babies are born prematurely, as well as if they become sick, they require a ventilator or a breathing machine to help support breathing, which they cannot do on their own. Medical team inserts a plastic tube into the mouth, which then sits right above the lungs, and the ventilator or the breathing machine can provide pressure, support, as well as oxygen until the baby gets well enough to breathe on his own. Babies then can be placed in an incubator or an isolette such as this one. It has insulated sides, provides heat and warmth, as well as mimics the mother's womb. Sometimes we keep it covered with a blanket, and it helps block light as well as sound. That helps them sleep better and minimize stimulation. When your baby is admitted into the NICU, they will require IV access. This could be in the hands, the feet, or the scalp, and this allows us to give fluids, nutrition, as well as medication. Immediately upon admission, your infant may also require umbilical lines, which are placed in the umbilical into the vein or the artery. The umbilical artery provides means to draw blood labs because babies that are on ventilators do require frequent blood gases, and this prevents numerous heel sticks. And the umbilical vein that line allows us to give blood as well as medications as well.
Hello, I'm Talitha Richardson. I'm a respiratory therapist here at Geisinger Medical Center, and I work with the medical staff to help your baby breathe more comfortably. If your baby is here in our NICU, one thing you may see is they may be intubated, which is a breathing tube that's placed just down their throat just to help them with their breaths. While your baby's here in the NICU, they may also receive something called chest PT, which is chest physical therapy. What we do is we use a little percussor that will look similar to this, and we just tap it on your baby's back or their front chest, and what it does is it breaks up the mucus just to kind of loosen it up so that we can then remove it from their lungs, and it also kind of opens up their airways. If they're a little bit underinflated, it just kind of pops them open. If your baby has a breathing tube in, they will be placed on a ventilator or a breathing machine. A reason that they would have the tube in is if they're premature or if they have some respiratory problems. The ventilator can do a variety of things. It'll support your baby's breaths. Sometimes it'll support every breath, and sometimes it will just give them a little extra just to maintain them until we can wean them off of this.
A few days after admission, sometimes even 12 hours after admission on preemie babies, they require billy lights. They're a blue set of lights which break down the bilirubin from the excess red blood cells after birth.
Upon admission to the NICU, your baby will be assigned a resident physician who is overseen by a neonatologist. A neonatologist is a pediatrician who specializes in the neonatal intensive care unit. These physicians lead a multidisciplinary team, otherwise known as the rounding team, which may include respiratory therapists, nutritionists, nurses, case managers, social workers, and other highly specialized physicians. The rounding team will meet at your baby's bedside daily to review the plan of care for your son or daughter. We encourage your participation in rounds, as this is a good time to gain understanding and ask questions while actively participating in your baby's care. For your infant's safety, the NICU is a locked unit. Our open visitation policy welcomes healthy parents and their visitors in limited numbers. With parental supervision, sisters and brothers of your baby are also permitted to visit. For the safety of your baby, there may be times when visitation is restricted. Your baby's nurse will work with you to ensure you are informed about the most current visitation guidelines.
Hi, my name is Shauna Mensinger. I am a registered nurse and a board-certified lactation consultant here in the NICU. We in our NICU feel that breast milk is a very important part of taking care of preterm and sick infants. Breast milk has many components that help strengthen an infant's immune system and help them fight against infection. Breast milk also has growth factors and hormones that help an infant grow and develop. Our NICU has a pump room where mothers can come and use a breast pump in privacy at any point in time of the day. We also have breast pumps available within the unit that a mother can use at her baby's bedside to pump while she is touching her baby and looking at her baby, which is a huge benefit for maintaining milk supply. We also feel that skin-to-skin care is a very important part of taking care of the preterm and sick infants. Skin-to-skin care is when a mother or a father is holding their baby wearing only a diaper next to their chest. Skin-to-skin care can help an infant in making them feel comfortable, keeping them warm, regulating their heart rate and their breathing, and it creates a strong bond between infant and parents. Our NICU has a team of lactation nurses available every day of the week to help you with any questions you may have. We can help you find a pump for use outside of the hospital, We can provide a pump for you while you're here in the hospital, and we can also help you find a resource near you so that you can continue breastfeeding after you're discharged from the NICU.
While your baby's hospitalized in our neonatal intensive care unit, we have a family waiting room that's under a lock and accessible to our NICU families only. In addition, we have a NICU family support specialist. We're actually the only NICU in Pennsylvania that partners with the March of Dimes and staffs a family support specialist that does a variety of programs for our families while their babies are hospitalized. We have a Ronald McDonald House located on hospital property that is available for you to stay overnight at while your baby is hospitalized in our NICU. Hand washing is very important to the safety and well-being of your child while they are hospitalized in our NICU. Before each and every visitation, please take the time to thoroughly wash your hands with the hand sanitizer found on the wall or at a sink nearby before crossing into your baby's bedside, which is indicated by the yellow and black lines on the floor. While your baby is hospitalized in our intensive care unit, parent participation is very important to us and to your baby. There are a number of ways that you can participate in care of your child, such as changing their diapers, helping to dress them and swaddle them, learning to feed them, and give them medication. And prior to your baby's discharge from our hospital, we may ask you to come back and spend the night here in our demo rooms, which will give you the opportunity to practice all of their care and be completely comfortable before your child is discharged to home. Also, while you're here in our NICU, there are a number of other programs that you can participate in, such as CPR and our discharge planning class. Finally, what everyone is very excited to know is what your child needs to do to be able to be discharged from our hospital and back to your home. They need to be taking their foods by mouth, they need to be keeping warm, and have appropriate weight gain.
I'm Dr. Jim Cook. I'm Director of Neonatology at Geisinger. On behalf of the entire NICU team, we hope that you found this video useful in preparing for your baby's admission to our newborn ICU. We really do value taking care of both you and your baby, and please know that if you have any questions, you may feel free to ask us at any time, either by talking to the staff at your baby's bedside or by calling the NICU at 570-271-6550.